so a little bit of an introduction about Dr. Sean Leo. He's an orthopedic surgeon at Orthosports, specializing in sports, knee, and lower limb surgery. When he's not in his clinic, you can find him sweating it out and engaging in various endurance sports like cycling and running. So besides being an athlete, Dr. Sean has also contributed his training by being the team doctor for rugby and football clubs, as well as being the cage side doctor at high-profile MMA events. So Dr. Sean is particularly interested in helping people with knee injuries and pain to get them back on their feet sooner and recover faster. So whether you're an aspiring professional athlete or a weekend warrior, he has the solution for you. So finally, let me pass the time to the star of the show, Dr. Sean Leo.
Hello, everyone. I just want to start off by saying it's a real big honor to be able to be speaking on this channel. And thank you, Jason, for your invite. Today, I'll be speaking about something which I deal with pretty commonly. I'll be talking about sports injuries, and then I'll be zooming into one particular sports injury, which happens to be one of the commonest injuries that orthopedic surgeon sees, which is the ACL tear. And then subsequent to that, we can have a little bit of a question and answer where I get to answer some of the questions that are on your minds. Okay, if we can just go on to the next slide. Just a little scope of what I'm going to go through today. I'm just going to be talking a little bit about sports in our life, then the injuries sustained during sports, the common lower limb injuries. Now, of course, injuries can happen any part of your body, but lower limb injuries tend to happen a lot and quite often in sports events, which, or rather sports which require you to do a fair bit of running or contact and all that. Lower limb injuries tend to happen quite often. And then I'll zoom in more into the anterior cruciate ligaments as I mentioned earlier. Okay, next. Sports has certainly changed our lives, as well as it's also become quite a integral part of it. It's not only an entertainment to a lot of us who like to watch NBA or soccer. It's also become a kind of like a social interaction where people get together, people talk about sports, people get excited about watching MMA fights and going to MMA events. And it also has got other aspects like joining the sport itself, participating in it to keep healthy, and to some people it's actually an occupation. I mean, you can be a professional athlete doing sports at very, very high level. There are a lot of new forms of sports that have becoming more mainstream. These things were not heard of maybe about 15, 20 years ago, but they are increasingly more popular, and they have gotten a lot of social media coverage. Things like CrossFit, ultimate frisbee, cheerleading, skiing, indoor rock climbing, trampoline jumping. These are things that when I first started work as a medical student, and when I was first actually in the medical profession, I haven't actually heard of any of these sports before. Maybe skiing I have, but most of the others like trampoline jumping and ultimate frisbee is not something that is pretty common in the early 2000s. But as these sports start to develop, we actually see more and more people participating in them, and then they each have got their unique kind of injury pattern. And I mean, to understand these sports and the risk that it presents, you should be able to then take the adequate precautions to make sure that you go back into playing the sports if you do engage in them at a fairly high level, and you should be able to enjoy them quite a bit. Now, every single sport that you play has got a risk of injury. Even things like pool and billiard. Yeah, I have patients coming to me who play a fair bit of pool and billiard, and then they complain of neck pain and shoulder pain because they spend most of their time looking down the pole and trying to get their shot lined up. So they crane their neck up quite a bit, and sometimes the shoulder pain after multiple cue strikes, they also have shoulder pain. So even games that do not involve much contact, or even though people might think of them as fairly safe and fairly sedentary, you do also get some injuries, and it's important to be able to identify when you are having some trouble, and then know what to do with it. Okay, but of course, outdoor related sports or contact sports still have a higher chance of getting yourself injured, and those are usually the kind of patients that I see, people who are participating in some form of either contact sport or some form of physical activity that results in an injury. Next slide, please. Yeah. So as you can see from this slide, yeah, any part of your body can be actually injured when you are participating in a sport activity, and this can include anywhere from your head all the way down to your feet and your toes. The different sports will obviously require different skill sets and require different equipment. So it always pays to have adequate safety gear in place. I mean, if you are going rollerblading or you're going cycling, things like helmets or pads are important. They prevent a fair number of injuries, and they keep you healthy and enjoying your sports for as long as you can. There are also importance in proper instructions, especially for those that require skills like skiing, CrossFit, etc. These are things that are really fun when you are doing it. But if you are taking part in it for the first time, it is essential to get proper instruction, and it's always good to have somebody coaching you, and paying that amount of money to get a coach certainly benefits you, because you may be able to save a lot of money getting your injuries treated if you had otherwise tried to do it yourself. Okay, so as you can see, my favorite martial arts character here, Bruce Lee, he was saying that the agility, the flexibility is actually very important in a lot of things that you do, and I believe that that's an important thing as well. Through warm up, through conditioning, and through stretching, you can actually condition your body such that you can take a lot more strain, a lot more stress, and it helps you become a better athlete in general. These are basically just general advice that I'm giving for injuries to be prevented in the sports that you participate in. So if you are able to be flexible, you are less likely to injure yourself in terms of getting muscle strains, in terms of getting fatigue, or in terms of getting improper positions of your joints when you are taking part in whatever activity or whatever sports that you're taking part in. There's one more thing that is very important in when we consider sports injuries, and that is to have adequate rest. Now, if you are participating in sports and you are participating in it in a very high level, it is fairly common that people talk about pain is weakness leaving the body. Well, while that is pretty good for having a very strong mental mindset in order to do your sporting activity, it is actually equally important to rest adequately. If you do not rest adequately, the chance of you getting injuries, either chronic strains and sprains, increases. It also actually increases your chance of having acute injuries, because sometimes your muscles, once it is too tired, it is unable to be the primary stabilizer of your body in your joints, and that causes an increase in risk of you getting injured. So in general, every sport comes with risk. However, one wise doctor once told me that it is actually less risk in having activity, even though we consider all these sports injuries, than if you participate in continuous inactivity, which means that you decide that the closest that you get to sport is watching it on TV or playing on PlayStation. So although there is risk involved in sports, as I've outlined earlier, it is better to take part in it and have a healthy lifestyle than to totally not take part in any sports at all. Okay, next slide, please. Okay, so when I look at sports injuries, I usually classify the sports injuries into three basic categories. My patients either come to me with an acute injury, and when doctors mention acute injury, we mean that it is a new onset of a problem that didn't previously exist. This usually occurs after some form of injury, like if you are playing soccer, for example, you twisted your knee, and previously you were well, you're running well, you had no pain at all in your knee, and then you twisted your knee and your knee is now swollen, you are unable to put weight on it, and you cannot walk properly abruptly. That's an acute injury. Similarly, a broken bone is also an acute injury if it happened suddenly, like if you had an impact or you were mixed martial artist, and then you had a kick right into your leg, and then you have pain and your leg collapses. That could be an acute injury. You didn't previously have this problem. A chronic injury is one which you actually have a problem before. It hasn't completely recovered. It continues to trouble you, and suddenly, because of your activity, it can get exacerbated. So chronic injuries are usually underlying problems that have been plaguing patients for a fairly long time. They are otherwise quite comfortable with it sometimes, like there's a baseline level of discomfort, but some of the patients have grown to accept that. And if they aggravate the situation, then it becomes what we call an acute or chronic situation, whereby you have got a new spike in your old problem. All right, so that's chronic injury. And then the last one is a whole other group of injuries, which I tend to want to lump it together and call them an overload or stress-related injury, where you sometimes participate, or you sometimes do things too much more than your body can handle. It is not something which is a sudden great injury to your body, whereby your bone breaks or your ligament tears, but because of the constant stress that you put your body on, your body doesn't have a chance to recover in time. And because it doesn't have a chance to recover in time, parts of it starts to break down and starts to have stress. And that stress-related injury, if you ignore it and it continues to build up, then of course it will progress into becoming an acute injury, in which case you cannot ignore it anymore. So if you understand or you can pay attention to some of the key symptoms related to stress-related injury, you can actually prevent yourself from getting into a worse situation than what it is now. Okay, next. Okay, so why do we talk about lower limb injuries? And well, lower limb injuries are actually my favorite part of the body in terms of treating injuries, but they are also one of these areas which tend to get most injured, and that's probably because we put a lot of stress on our lower limbs, usually in terms of carrying our body weight, having to run, having to jump. A lot of stress goes through our legs, and because of that, the chance of injuring it is also high if you get pushed, or if there is a problem with balance, or if somehow the movement that you are making, like for example, when you are participating in mixed martial arts, etc., if you are kicking in a wrong way and you are pivoting in a wrong way, you might actually injure your ligaments within the joints. Certainly upper limb injuries, neck injuries, spine injuries, all can happen, but I do see a significant proportion of lower limb injuries in my practice. Yeah, and the lower limb injuries can simply be classified into four groups when I look at them. Yeah, you can have injuries to your bone, where they come in terms of a fracture where the bone breaks, or a stress injury or stress fracture where the bone doesn't actually break, but the internal contents of the bone, what we call the trabeculae bone, has a little bit of injury and small micro cracks in them. So those are called stress fractures. And if you do not take care of those stress fractures, if you continue pushing, the stress fracture will then become a full fracture. You can also have joint injuries, and joints within your lower limb, usually the hip, the knee, the ankles, the small joints of the feet, and many things can happen in the joint. You have got cartilage in your joint, which can get damaged. You have got other specialized tissue within your joints, like the meniscus, which can get injured as well. And of course, the capsule and the ligaments surrounding and the tendons surrounding your joints can get injured. As for muscle injuries, you can have strains and strains, and this new or it's not new, but recently we see quite a lot of it. It's called rhabdomyolysis, and that's when your muscle breaks down through very intense activities. And I do see quite a bit of patients that come to me after a very intense activity like spin classes, where they suddenly taking on something that they are not used to. They push themselves really hard, and then they have got severe pain in their muscles, and maybe a day or so later, they may actually find that the urine has changed color to something which is dark chocolate, or even some people think that they have passed out blood. And that's because the muscle actually breaks down, and your muscle contents, the myoglobin, gets released into your bloodstream, and it gets filtered out into the urine. Then the fourth one are tendon injuries, things like Achilles tendonitis. The tendons are basically the tissues that join your muscles to your bone. So if you stress those areas too much because of overexertion of the muscle or repeated exertion of the muscle, sometimes you get tendonitis at those joints, at the places where the muscle attaches itself to the bone. Okay, now, if you do feel that you have an injury, or if an injury occurs, of course, there are certain things that you want to take note of, and these are things which your doctors are actually going to ask you. So it will be good if it occurs as you are treating your injury, or as you realize that you're injured. You should take note of these things, and it will help the doctor in coming to a diagnosis. How the injury occurred is pretty important. Now, most of the time, injuries can occur quite rapidly, and sometimes because of the fatigue, and sometimes because of the excitement and all, or being participating in the sports, you might not actually remember how it happened. But sometimes your teammates can give you an idea of like what happened, or if a spectator is around and you're close to them, they can actually also tell you what happened. There are a couple of videos which I'll show later, and those couple of videos actually are taken by some of the friends of my patients, and they are able to present what happened very clearly, and that actually gives the doctor a very good idea of what you may have injured, and that will certainly help a lot in terms of the diagnosis as well as the treatment that is going to be offered. The other things that you should take note of once you get injured is what happens after the injury. I mean, certain things that we usually ask are, is there any swelling in the area that you got injured? Are you able to continue the game? Are you able to walk? Are you able to still use your arm? Do you feel anything funny going down your arms or legs? Yeah, things like that are important to take note of, and these are also things that you want to note if it is getting better, or is getting worse, or is about the same. Okay, and then of course there are specific symptoms if you're talking about the lower limb that doctor would look at, which is whether or not you give way, whether there's locking, inability to bear weight, and there's any swelling. Now, if any of these specific symptoms that I mentioned at the end occur, it usually means that you have a pretty serious injury, and it would be a good idea to actually seek medical attention early. I mean, usually if you have things like giving way or inability to weight bear, it means that your limb or your joints aren't actually functioning properly. Yeah. Okay, next slide. Okay, so the X-rays as well as the specialized investigations, as I mentioned earlier, the doctor will actually use this to help diagnose what is going on. Next. Okay, so this is a video. We can play the video. This is a video of one of my patients who was rock climbing, and he kind of missed a jump and he fell down. As you can see, his knee was actually twisted, and it's if you notice the bone on the top and the bone below, it is actually pretty wide apart. He actually tore quite a few of his ligaments, as well as his meniscus was torn, and he had a pretty bad injury to the knee. Okay, and he injured the ACL, but besides that, this is almost near dislocation kind of situation. The reason why I showed this is because you know, a knee injury can happen in many circumstances. It can occur whether it's contact, non-contact. It can result from a fall, non-fall. It can also occur by itself or with other injuries. And this gentleman unfortunately had a fall, and then he had a ACL tear together with a whole bunch of other injuries in the knee. Okay, next. Okay, yeah. So ACL injury, which is one of the most common things that occur in the knee, as you can see, this American football player is actually you have a pivot injury, which is a twisting injury, whereby your lower bone turns in one direction and your upper bone turns in another direction. Now, this guy obviously didn't have anybody near him, but because he was turning very, very quickly and his feet are planted on the ground with the studs in the soil, what happens is that the foot is unable to move while his body is moving, and that results in a twisting injury, which causes the knee to buckle and the ligaments to tear. Now, if you tear your ligament, your bone can also hit each other in a different area. You can injure the bone, you can injure the meniscus as well. Okay, next. Yeah. So why are ACL injuries so common nowadays? Well, I suppose there are many reasons to that. First, we have a better understanding of the knee joint, and with knee joint and with better investigations and better imaging, we are able to pick it up much earlier because a lot of people also know about the ACL and they have heard about it. They have heard about it from their friends who have injured it. There's more awareness of this. There is an increasing number of people participating in sports which involve pivoting, turning, even things like rock climbing or trampoline jumping. Yeah, so that exposes your knee to increased injuries. And then, of course, if you are tired and you are jumping and you are training yourself, you actually have got a higher chance of injuring yourself because your muscles tend to be less able to adapt when you are actually shifting positions and you're turning. Usually your muscles are your primary stabilizer. If your muscles are not working very well because of they are fatigued, then you are unable to control your momentum as well. Next. Yeah. So one little known fact, or actually something that not many lay people would know, ACL injuries are actually a lot more common in ladies than in men, and that's because of the way that girls or ladies tend to jump and land. They tend to land with their knees pointing towards each other, and that actually increases the risk of your ACL being injured. It kind of puts a torque on the lower leg and another torque on the upper leg, and that that puts your knee into the position where the ACL is likely to tear. So one of the important things about ladies who are participating in sports and in activities that require jumping is to be able to train and to be able to basically condition themselves so that they are able to land and jump and land in the neutral flexion position, whereby the knees are actually pointing slightly outwards rather than pointing inwards. Okay, next. Yeah, because if you have fatigued muscles, as I mentioned earlier, you might not be able to control the momentum, and because you can't control the momentum, you actually might injure yourself more easily. This is another one of my patients who was playing soccer. And you can play the, oh, sorry, can the video work? Yeah, so this wasn't really a very rough check that he had, but if you see, he was just basically going for the ball, and yeah, and he kind of lost stability. I mean, he thought that the push the other guy gave him wasn't really that bad, but what he described was that his leg was kind of stuck in the ground, and he was unable to put his body upwards or right himself after he got nudged by his opponent. So that was also a twisting injury, and then he also collapsed. He felt his knee just give way and collapsed, and he also had an ACL injury. All right, next. Okay, so certain things that you should do after you have joint injuries, you should rest, ice compress and elevate. That's the simple thing that you can do right after an injury, especially at the court side or on the field side. You can just quickly institute all that. Certain things that you shouldn't do, things like you shouldn't take alcohol, you shouldn't try to run off the injury, you shouldn't try to test it by jumping on it to see whether or not it still holds. And massage, sometimes in the early phase, massage may not be such a good idea, because what it does is that it causes a little bit of swelling, and it causes a little bit of localized injury to an area which is already injured. So massage may not be the first thing that you want to do early. You might want to ice it first, rest, ice, compress, and elevate. And then if the pain goes away and the swelling decreases, then maybe 2 or 3 days, you can try to massage the area to see if it gets better. Okay, next. Okay, so if the pain still persists beyond 2 weeks, I think you should, I think a good advice that I'll give anyone would be to stop playing, stop participating in what you're doing, and get yourself evaluated by a doctor and see if you have got any long-term injury or any structural problems with the knee or any other part of your body that you have injured. Next. Yeah, so one question which I think a lot of people would like to ask, or one of the most common questions which I get from either the patients or the parents are, if you have an ACL injury, do you really need surgery? Now that's actually a pretty interesting question, because there isn't a correct answer. There isn't a yes, you need surgery, or no, you don't need surgery. It all comes down to what you need the surgery for and what you think you can benefit from the surgery. Now, the guy I put on the right of the screen, his name is Dijon Blair. He's a professional NBA player, and he doesn't have ACL in either of his knees, and he's still playing professional basketball. The reason why he can do that is because he's very, very well conditioned. And I explained earlier that your muscles are actually very important in terms of being able to control and stabilize your knee. So this person is very, very well conditioned in terms of how fit he is and how strong his muscles are. He's able to do what he does despite the fact that he doesn't have a secondary stabilizer, which is the ACL. And ACL is a very important secondary stabilizer. He's still able to play. Not many people are at this level of physical conditioning. Yeah, of course, if you get to this level of physical conditioning and you have the skill set to begin with, he probably was a very skillful basketball player prior to getting injured. He could probably still be able to do what he does at that particular level. Another very practical example, there are some ski instructors or ski coaches who have torn the ACLs, and yet they are still skiing, and they're still teaching people how to ski. It's not because they don't have any instability in the knee, but it's because they are able to condition themselves such that their muscles are able to stabilize their knee enough, and they have got enough skill prior to their injury to be able to continue what they can do. It's not something that everybody has or everybody can do. And I would say that for ACL to be torn, it is actually a pretty significant trauma to the knee. If you are still young, and if you are very, if you participate in sports a lot, your sports involves a lot of twisting and turning and pivoting, then of course a surgery is actually going to help in stabilizing your knee, getting you back to the sports that you want to do. And it also prevents further injury to other parts of your knee if the ACL is present and gives you more stability and support. Now, if you don't have an ACL, you can still go back to play, but it's just that you assume a higher level of risk, because if your knee is not stable, you tend to injure other parts by actually having your knee give way, and then your knee goes out of alignment. You injure cartilage, you injure meniscus, and then the problem becomes compounded. It becomes a larger problem than just an ACL tear. Of course, it also this requirement for surgery also depends on what kind of activities you are doing. If you decide that you're not going to do anything which is physically very active, or you decide to give up the activities that require a lot of pivoting, there's a fair chance you are able to get along with life pretty well without ever the need to do an ACL reconstruction. I think there are quite a few people walking around without ACL, and they're quite okay. And of course, the older you get, the less likely it is that you are going to do all these physical activities, and therefore the ACL may probably be not so essential to fix if you are older and more sedentary.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.